I'm Gordon Francis. I'm a physician scientist at St. Paul's Providence Healthcare, and I'm a scientist as well. And I spend about 70% of my time studying how cholesterol leads to heart attacks and what cells cholesterol accumulates in the arteries that cause heart attacks, and how can we get rid of that excess cholesterol to reduce heart attacks and strokes. So when we all have a certain level of LDL, sort of the bad cholesterol in our blood, and depending on how high a level you have, more of it can go through the lining of your arteries, like the coronary arteries, and get trapped in the artery wall. So in the artery wall, there are cells called smooth muscle cells, and they secrete these proteins that are negatively charged, and the LDL is positively charged. So what happens is, because of their charge-charge interaction, the LDL gets trapped in the artery wall. And that can happen over decades of life, and will happen immediate, exactly proportional to how high your LDL is in your blood. So you don't feel high cholesterol. The only way to know you have it is to get the blood test. Even if you're extremely fit and you have a very clean diet, what predicts our cholesterol levels is about 80% genetics and only about 20% lifestyle. Like a very high fat diet typically doesn't cause great big elevation of cholesterol. It tends to cause mild elevation. But genetic causes of high cholesterol tend to cause higher levels. So we can tell just by looking at someone's pattern of their cholesterol levels over time, whether we think they have an inherited tendency to have high cholesterol. If you have a disease called familial hypercholesterolemia and your LDL is always 5 when normal would be 3, you have a lot more cholesterol going from the blood into the artery wall and collecting there and causing plaque buildup. And you don't feel that. So it is possible to reverse the buildup of excess cholesterol in the artery wall by lowering the LDL from a young age, and that takes medication. If you have genetically high cholesterol, you reduce the amount of cholesterol that is going to be allowed to go into the artery wall. And when you lower the cholesterol, collected cholesterol in the artery wall can actually gradually be taken away.